Hey everyone, I know this is kind of random, but today I just kind of wanted to make a little video about TMJ, which is, well, TMJ technically is the jaw joint, the temporomandibular joint, but TMJ, as we often think of it, is a sort of like a problem with the jaw where it doesn't like fit right, and all sorts of bad things can happen as a result. I just wanted to make this video because I've been, well, in my Brita versus Bobble video, I mentioned in the description of that I don't have a Camelback water bottle because you have to like bite the valve to make it give you water, and I didn't want to even risk that because I'd read that that can be really bad for your TMJ. And so I've actually been commenting back and forth with a YouTube user named Kiwilovestutus, really cute name by the way, about TMJ because she can't open her mouth, and I just I know all about that, and I just kind of wanted to, I don't know, maybe put some information out there. So basically TMJ, your jaw doesn't fit right for whatever reason. I've heard that it can be hereditary. I've heard that there can be a link to having had braces or other dental appliances, which I certainly did. I had a bunch of different dental appliances starting from the time I was about 5 years old, including I had braces for about 3 years. My mom also has TMJ, so I'm not sure why I have it, if it is a hereditary thing or if it is because of all the dental stuff that I had done. In either case, I have it, and I've had it for a long time. I think I first noticed it when I was like 14. My jaw would just bother me and I'd get headaches, and sorry, my cat's trying to get in. And maybe I'll let him. No, I don't know. But yeah, I remember one night when I was like maybe 15, my family was having steak for dinner, and I was sitting at the kitchen table with my parents, and my mom, who would sit across the table from me, she just looks up at me, she's like, "I can hear your jaw all the way across the table," because it makes these crazy cracking noises. But basically, TMJ, if you've had it for a while, you kind of start to learn the things that bother it and how to deal with them. Like, I know that there's certain foods I shouldn't be eating, like very chewy foods often bother it. Like how I don't eat meat anymore, but like how I used to eat steak and other meats, like if they're tough or chewy, that will definitely aggravate it. Any kind of like chewy candy, like gum. I really love Skittles, but I can only eat like a few of them at a time. Like if I buy that whole like little, bag that you get at like the grocery store in the checkout lane, and I eat that whole bag, my jaw is just like, oh, why did you do that? It just hurts so bad. So I know that I shouldn't do that. Sometimes even eating foods like apples or other foods where like you have to like really open your mouth to get a bite of, those can be aggravating. So one thing that you definitely learn is kind of like what foods to avoid, and another thing is sort of like kind of how to take into consideration certain environmental concerns. Like I know that for me, in like if it's really windy out and there's lots of like wind blowing past my, the sides of my head, kind of past my ears, I'll get like these horrible shooting pains down into my face, which as far as I can tell, that's a TMJ thing. My mom gets them too. Maybe you do as well. Cover your ears. Like either get some earmuffs or I always make sure I have a hoodie, and I will be that ridiculous looking person who ties like the hoodie string really tight so that you can only see like this much of my face, just to prevent that wind from going past my ears, because I have cried. That pain is just so bad. It's like somebody's taking knives and stabbing them into your face. So also try to be empathetic toward TMJ people. Like if you don't have it and someone that you do care about does, they may have times where life is hard for them. Like if they can't open their mouth all the way to eat something, don't laugh at them. Just don't say rude things. Like I remember one time I couldn't open my mouth for about 6 months, and I got a lot of comments on just like from friends, from people in my life about, oh, how you only get TMJ if you overperform certain bedroom activities that I will not go into detail of here. And I'm just like, No, that's, but it's just, I felt it was really unkind for, like, people to be saying things like that, like, when I couldn't open my mouth wider than, like, to put my finger in it for 6 months. Which the reason for that, it's kind of a funny story, really. I went to see The Passion of the Christ in the theater, and if you've never seen it, it is so violent. Like, it is, like, the most violent movie I've ever seen in my life. And I was basically sobbing and clenching my teeth the whole time. And I went to see it with the church youth group. And when, like, after it was over, we went back to where the church group met to eat pizza. Because that's, how you celebrate such things. And I couldn't even open my mouth wide enough to eat a slice of pizza. And, kind of over the next few months, it got better, a little better, but basically I couldn't open my mouth fully for about 6 months. Finally, one day, that following fall, I woke up and I could open my mouth. I don't know what I did that was different, that suddenly allowed me to do it. I could open it. But yeah, so that's a thing. I will say, if you can't open your mouth right now, or that ever happens to you, just try not to lose hope. You'll be able to open it eventually, hopefully. I mean, but the thing is, you don't know if it's going to be for a couple days, or for 6 months, or for longer. Try to talk to your doctor. I don't know if there's a lot that they can really do. I found that if I took, like, ibuprofen, like Motrin or Advil, that kind of seemed to help give me a little bit of a better range of motion, and also helped with the pain. But I mean, it's not a fix-it-all completely kind of thing. Let's see, what else? Basically, just be careful. It may become something that you're going to have to learn to live with on a daily basis. My jaw doesn't lock up so much anymore. I've kind of learned what I need to do and not do to try to keep it happy. I baby it as much as I can. There's certain foods I don't eat. Like, if there was a time where me and my husband were supposed to be watching our nephew's Little League game, and it was so windy, I had to go inside of, like, where, like the youth center or whatever. Like, I felt bad, but I couldn't be outside with my family. Like, I had to go inside because just the pain was so horrible, from the wind. Basically, just be patient, take Motrin, talk to your doctor, talk to your dentist also. A lot of dentists would like to know that you have TMJ, or, may be able to help you figure out if indeed that's what you have. Because I know my dentist, he goes really gentle on me. Like, if he has to do a cavity or, whatever, and he has to, like, jack my mouth open, he doesn't do it quite as wide as he would for someone else, because he knows that my jaw could get stuck there. It is a valid concern. But yeah, just tell all your healthcare people that that's a concern that they need to be mindful of. And people might call you a whiner. Just, make your jaw make noises at them. Let me see if I can get you to hear it. I don't know if you could hear that. But basically, every time I open my mouth, it sounds like Rice Krispies are in my head. So, every time I chew or talk, like, I mean, not like when I'm talking, well, I guess I can kind of hear it, but mainly when you go, like, I can hear it really loud. But yeah, they're doing all kinds of, studies about what causes it more. I actually participated in a study, last year about it, where, I had to basically go, and they poked and prodded me and made me do all these concentration tests and took blood, and I had to fill out just pages and pages of surveys, and every few months I had to fill out more pages of surveys. And but yeah, I mean, I think they're trying to figure stuff out. There have been times where I've thought about getting the surgery, or just idly thought about getting the surgery, especially during that 6 months when I couldn't open my jaw. But basically, my understanding of how they do the surgery is they break your jaw, wire your mouth shut, and reset it. I understand that the rate of your problem getting worse is actually quite high. So Just try not to lose hope. You know, it can get better. You know, like I said, I just was thinking I was probably doomed and was never going to be able to open my mouth all the way again. And then one morning just opened. So yeah, so Kiwi loves tutus. I don't know. I hope that this helps, and anybody else who has anything TMJ related worries and stuff. I hope this helps too. Definitely feel free to ask me comments. I will, or questions rather, in the comments. I will be more than happy to answer anything I can to kind of like cheer you on. I don't know. I know probably it is a very valid and real concern and health issue that I think a lot of people don't take seriously enough. You know, like I said, people have laughed at me and told me I was just being a whiner, and I mean I very seldom cry from pain, and I have cried with the pain of my jaw so many times. So, you know, at least know that I'm always, I'll always listen, and I'll, you know, not judge you. So, I hope that helps. And yeah, so leave me comments, and thanks for watching.